Okay, it's been a few weeks since we've all had the chance to get together, so I'm so glad that folks have joined us on this Friday. Feels like we should have a much longer weekend than what we do. There should be a state holiday tossed in here somewhere. But anyway, for those of you that did have the opportunity to take some time off but hopped on with us anyway, we appreciate you being here. One quick reminder, if you have questions or comments, please put them in the chat box and send that to all panelists so that we can make sure that the right person gets that question. And with that, I am going to turn it over to Dr. Stanislaus.
Good morning, everybody. Just want to give a little COVID update to the team. As we know, the COVID numbers have gone down. Our rates are low right now in the Missouri area. But however, there's another variant, which is the another variant of Omicron, BA2. And the numbers from BA2 have been rising up in the East Coast, especially in New York and other states. And they are looking at about a 5% jump week to week. So we are just waiting to see how it would impact us in Missouri. The other thing is also we're looking at what that impact could be with regards to hospitalizations and having serious outcomes from the virus. It's considered at this point that it is, even though it's more infectious, it is going to be milder than the other variants, but we still need data to show that. So we're waiting for that kind of data. And until then, until it goes up, we will keep you posted. And as we learn more about it, we will keep you posted as well. The other thing that's in the news now is about the fourth booster shot. So the CDC has recommended that individuals who are 50 years and over and who have had their previous booster 4 months ago. So if you're 55 and over and you had a last booster 4 months ago, then you're eligible to take your fourth booster, and you could do it either Moderna or Pfizer, whichever you can get it done. You can take it from your local pharmacy. It's pretty easy to get the booster. So that's a recommendation for CDC, and the reason for that is that they do see a decline in antibodies titers after time has passed. So every time you do a booster, the antibody titer goes up and the protection is better. The other individuals who will benefit from the fourth booster are those who have immunocompromised conditions, who are at a high risk for having negative outcome, and typically that also includes individuals with intellectual disability. They are considered high risk for a negative outcome, and also if they have immunocompromised conditions, then you could give the booster over the age of 12. People who have had the J&J vaccine, they're recommending that if they've just had the J&J vaccine, to go ahead and get another, to get it boosted with a Moderna or a Pfizer as well. So these are the recommendations from the CDC with regards to vaccination. One thing to remember, one thing to remember with vaccination is if you're vaccinated, you can still test positive for the virus, which is happening quite a bit. So you're having breakthrough infections. But what the data shows is that the risk of having a serious illness or ending up in the hospital or ending up in the ventilator or having a negative outcome is significantly less when having the vaccination and being boosted. So that's all I have, and I'll be willing to take any questions anybody else have. You can put it in the chat and be glad to answer. That's all I have.
I don't see anything in the chat at the moment. Thank you.
Thanks, Dr. Stanislaus. Appreciate the update. Good morning, everyone. Happy Good Friday and happy Autism Awareness Month. So this is, I have a few updates for you, but you'll be hearing a lot from the team on different things that are going on. And so one of the things I wanted to make sure everybody remembered is that the registration is now open for the Real Choices, Real Voices conference, and that will be in August. And it is August 28th through the 30th, and it's going to be at Margaritaville. So opportunity for families and individuals to connect, and so hope you will help us spread the word about that. The other thing is, and Heike, my screen is not allowing me to share, so maybe you can pull up the division homepage, because I wanted to let everyone know about a new kind of easy way to connect with the division for information. I know most everyone on these calls is signed up for the emails that come out, and also, you know, attending the calls that are announced through those emails. But you may or may not be connected with us through the social media platforms. And so we wanted to make sure that we are sharing content that way, and that we are able to connect with our individuals and families. And so I could just click through there on the main division page. There's a purple button now that says Connect with Us. We've got a button for that. And so you'll see there we are on 3 different social media platforms, and you could click on each of those, to each or all, to join us and connect with us on that platform, and make sure you share that with those in your network. There's also a monthly dashboard right above there that features just a quick glance at the prior month. So this is a view of March, and the communication from the division through each of the platforms that we use. You can see there on Facebook, the reach was over 8,000, and then on our Instagram, we are just getting that up and running, and we're also on Twitter. And so, yeah, just wanted to get the word out there so that we are making sure that we're being easily accessible to all. And with that, I am going to turn it over to Dwayne for some information about our new apprenticeship program.
Thank you, Jess. Good morning, everybody. We're very excited to announce the kickoff of our Certified Direct Support Professional Registered Apprenticeship Program, known as Missouri Talent Pathways, or MOTAP for short. MOTAP is a first of its kind program in the nation, which we truly believe will help us with narrowing the workforce shortage, developing a career pathway for direct support professionals, and also increasing outcomes for individuals. It was our honor to have the assistance of Governor Parson in announcing the launch of MOTAP through his social media and also his official news release on April 4th. And I'll put a hyperlink to that news release in the chat box when I get done talking. But MOTAP is a one-year program which blends on-the-job mentoring and technical instruction. Individuals that go through this apprenticeship program will start their program with a minimum base wage of $15 an hour, which will then increase to a 10% wage increase upon successful completion of the program. This is a program that will be available for new and current direct support professionals. We do have our initial recruitment onboarding webinar for this next Friday, April 22nd at 12:30 p.m. That information was sent out through our division listserv this morning. So if you've not seen it, you can definitely visit our website and look for updated emails that have been sent out. But again, we're very excited about it. We do think this is going to be a great opportunity, and it's something that we've been working closely with our stakeholders throughout Missouri, as well as federally, in launching this initiative. And with that, I will pass it off to Julie. Thank you.
Thank you, Dwayne. This is April, and April is Autism Awareness Month. Heike, can you hear me?
Yes, ma'am.
Okay, great. So yeah, April's Autism Awareness Month, and we've been promoting autism awareness through email blasts and the different social media platforms that Jess just highlighted. One of those blasts in particular was a call for more volunteers for the Parent Advisory Council members. And if you're not familiar already with the PACs or the Parent Advisory Councils, the Department of Mental Health funds 5 regional autism projects, and they provide autism services statewide. Each project has a Parent Advisory Council known as the PAC, and these are made up of parents or adults with autism. The PAC members advocate, they give advice, they offer consultation to the DMH on policy and budget and services and service providers. And they are always looking for new volunteers at the 5 different regions across the state. There is particular information about how to do that and just information about the projects and the PACs in general on the OAS webpage. And we'll get those put in the chat here in just a sec for a link if you want information on how to either share that with others or volunteer yourself. In addition to the projects in the PACs, another thing to know for April is the Missouri Commission on Autism recently revamped. They had their first meeting back in January, and they are working to identify needs and gaps as well as best practices. In particular, this first year, they're going to be working on identifying needs in relation to transition to adulthood. And the next meeting for the Commission on Autism is going to be April 28th in Jefferson City. And there's also information on the Autism Commission on the OAS webpage that you can find. We'll put that in the chat too. So next, I think Toy's going to update on Connection.
Guys, yes, I'm going to do a quick connection update with you all. Just 1 second. I'm going to, Mike, if you can pass me the ball, and it looks like you have, share my screen. So everybody is having a good Friday. Yep. Okay, so doing a quick connection implementation project update with this group. So just wanted to update on timeline and make sure folks are aware our current timeline has us having a system go live of May 17th, 2023. We are still on track for that. We are currently what's considered in phase 2, which is the design and build and configuration piece. We are actively working to finish out our requirements gathering activities by the end of this month for the original contract. And then for the contract amendments that we executed in January, we plan to close out requirements on those in May of this year. And then we'll move into finishing the build and configuration activities over the summer and then move into testing this fall. We are planning some testing activities, some training planning has begun. So we do kind of work on items in all of these different phases, but currently right now we're in phase 2, looking to move into phase 3 by this fall. As far as health indicators for our project, we are within budget on the project. Our 2023 budget has been approved by CMS for the fiscal match. We are at 74% completion rate for this project. And like I said, our updated project go live was May, this says May 15th. I'm sorry, I should have updated that. It's May 17th of 2023. And that shift was due a little bit. We were actually slated to go live in September of 2022, but with all of those additional programs and adding in our contract amendments, it pushed that out by about 6 months. As far as scope, like I said, we are within scope and just executing all of the requirements and build for what we have in the project. And as far as resource, we are working on new resources in the project. FEI's deputy project manager has resigned, so FEI is working on a replacement, and we're working on some additional resources to keep the contract either on schedule or ahead on FEI's side. So as far as our different phases of the project, this just tracks where we're expected to be completed per our project schedule versus where we're actually at with our work percentage complete. So right now, everything we are on track with besides testing. We're a little bit behind on our test scheduling and our UAT checklist, but we have mitigations in place to bring that up to speed. The division did just submit, so we have to go through CMS certification on this case management system. And we're excited to announce that we have submitted and CMS accepted our outcomes-based metrics and evidence that we will put through that CMS certification process. So we are working through that new CMS certification. Next slide. This just kind of goes through the details of things that we're working on. These FRDs, those are functional requirement documents. We are in the last stages of working on the assessment, claims and billings, intakes, and ISP FRDs. We have 10 interfaces in this project, and we're actively working with all of our vendors and other vendors and interface work. And then we have 11 migrations, and we're actively working on several of those, including service authorization and then the beginning of our ISP migration work. As far as scope, like I said, we are executing all of our contract requirements, and now we are starting the process of doing what's called a reliability tracing metrics to make sure that every single requirement we have in the contract and through our contract amendments has been executed the way the division expected it to be with the contractor. So that work has begun as well. So what's coming next for us is we'll continue to have these blocked requirement meetings through the May with our subject matter experts in the project to finish out the requirements gathering. And then in over the summer, we'll work on training materials and policy updates with those folks. And then this fall, we'll be moving into what's called user acceptance testing, formal user acceptance testing. We also have more walkthroughs and demonstrations coming for the larger group. So we just had one of those, I guess that was on April 6th, where we went through several modules. So we'll be posting that out onto Relias and sending that out through a division blast email for folks to be able to access and go to Relias to access that walkthrough. And we'll have several more of those walkthroughs scheduled for the rest of the summer. Let me see, as far as we're planning our user acceptance testing, and then we're creating our planning and starting to plan the pilot billing and claims updates as well. And then we're completing our training strategy and working on basically context and how we'll subject out those training materials. So for any questions or concerns, feel free to reach out, and then don't forget about our webpage as well. And I'll put that in the chat.
Toy, we did have one question that came in. It is connection will replace Seymour. Is that correct?
Most parts of Seymour. So it's not a full, so connection is not technically a full Seymour replacement. So I wanted to clarify that. But for most functions for the Division of Developmental Disabilities, it will. Seymour is not technically considered a case management system. It's more of a billing system, in all honesty, and a place where we house our service authorizations and contracts. EMT, so for relevant folks that use the EM and do EMT work, that still stays in Seymour, and there will be some billing processes that still stay in Seymour. So we're working on mapping documents that will really outline what functionality stays in Seymour versus what functionality is in connection. But for most items, connection will cover that, but it won't be completely all inclusive.
All right, thank you. And I don't think, well, let's see. There is another question that came in. Will there be some samples of what will be migrated from the ISPs into connection? And will the ISP templates in connection meet all of DMH standards / requirements for all the components needed in the ISP?
Sorry, to say the first part, I'm gonna have to break that out. It's a loaded question.
Okay.
So the migration, we will not be sharing our migration files. That's being done between the division and FEI. If we can share details about how we're migrating, that's open to doing that, but we wouldn't actually be sharing files, no.
Okay, and I went ahead and just sent that message to you directly so that it's easier to pull apart.
Okay. The next one, let's see. So technically the word, when you use ISP template, it's not technically a template, it's a form. That's the terminology we'll use with Connection, is it's a ISP form in Connection. And yes, it will meet all of DMH standards and requirements for all components needed in the ISP. The interesting thing, and let me know if this doesn't explain it well, but the ISP in the way that you think about it today is quote unquote, I guess, one large paper form. There's going to be multiple modules in Connection that will pull data over to then the ISP form itself. It's an advanced form in Connection. But yes, it is the subject matter experts that are working in the project to gather requirements for FEI to build out the plan. They used the ISP guide to help base that as well. I don't know if Jill's on the call. Jill, if you maybe have anything else. Jill Shoemate has been one of our key SMEs, but I would say yes to that question. We are meeting all standards.
And I don't see Jill on the call this
Okay.
morning.
No worries. So we can send more out on that. If that doesn't answer, just reach out to me.
Okay, and one more. It says, will there be any training geared specifically to service providers?
Yes.
Okay. And will we still be putting budgets into Seymour?
What budget? There's lots of budgets. So which specific one are we talking about?
All right. So while we're waiting on that, let me see if there's anything else.
And hi, I'm okay if we need to move to next presenter. I'd be happy. I can answer.
Okay. Any of the others I'll send to you directly.
Awesome. Thanks, guys.
Okay, this is Angie. Thank you for having me this morning. I apologize, I'm not on screen, but I am having internet trouble, so hopefully I don't pause on you. Heike, can you hear me okay?
Yes, ma'am.
Okay, great. Okay, so 2 quick updates for the team. Budget, we have our value-based payment initiatives and rate standardization and data interoperability. That funding is still progressing. The House Committee substitute did move some of the rate standardization funding and what would have been like kind of the second year funding for our enhanced spend plan to general revenue, all in fiscal year 23, from general revenue, all in fiscal year 23 to enhanced FMAP. That includes moving some of our VBP initiatives and data interoperability that would have been spent in fiscal year 24. They moved it up to fiscal year 23 instead. The departments had conversations about how that move for both the rate standardization and the VBP data interoperability will just require a general revenue pickup in fiscal year 24. So those conversations happened and they went well. We anticipate next week being a busy week in Senate, again with markups. So again, funding is still staying intact, and so that's good news, just kind of moving some of it around. Preliminary discussions for our rate study refresh. We want to go ahead and talk about that with everyone. We will soon roll those rate study refresh for waiver services. We'll be rolling those out. Our anticipated timeline is that you will receive initial communication in May to kick off the project, and then we will gather some data from stakeholders. Mercer will spend a couple of months to analyze and prepare the data for us, and then we anticipate that midpoint touch with stakeholders probably to be mid to late summer, and then a full wrap up in November. But as we flesh out the timeline, we will continue to share that with you here, as well as different stakeholder meetings and association meetings. So stay tuned for that. We're excited to get that process started again, right on the heels of wrapping up session. So with that, I'm going to hand it off to Emily.
Hi, good morning. Just a quick update. I think a lot of people have already heard that the federal PHE was extended, and that is now set to expire July 15th of this year. That'll take our 6-month Appendix K flexibilities through approximately January of 2023. We have a couple waiver comment periods coming up that you'll see blast on. The first one is the health assessment and coordination and rate methodology amendment that we have with MoHealthNet currently right now. And that amendment proposes adding the health assessment and coordination, or AKA Station MD service, to all of our waivers, which is currently in Appendix K. We want to make it a permanent service, so we're putting it in our waivers. Proposals to change the EAA, SME, AT, and crisis intervention from waiver year to ISP year. Increase in waiver slots.
I'm sorry, there's a lot of acronyms there. Could you?
Sure.
Thanks.
So just to kind of back up to changing EAA, which is environmental accessibility, adaptation accessibility, SME, specialized medical equipment, AT, which is assistive technology, and crisis intervention from waiver year to ISP year. And then increase waiver slots for the COMP, the community support, and the Partnership for Hope waivers, and increase the community support cap, increase that cap. That one we'll see planning for public comment on 4/22 through 5/22. So that one's shortly, that starts next week. The other one that you'll see in this summer, this June, July, will be the value-based payment amendment that Angie was kind of speaking about before I started, and that is to add the incentive payments to our waivers, and that planned comment period would probably be no definite time period yet, but June or July for that comment period on that amendment. That's all I have for my updates. Do I have some questions after that information on our amendments, though? I thought I might get some.
I don't see any, Emily.
Okay, and they pop up to me, and I'll answer through chat. So next, I'm going to hand off to Wendy.
Good morning, everybody. Happy Good Friday. And if you are from the Kansas City region, then you probably already know we celebrated Tim Wolf's retirement a couple weeks ago. He's the regional office director out of KCRO. And while we are sad to see him leave and are so appreciative of the leadership that he brought to the region, we are very excited to announce Lisa Tracy is now the regional office director for the Kansas City regional office. And she has been with the regional office for many years. I don't know the exact number, but I'm thinking 27 or 25 plus for sure. So she brings a wealth of experience and has a dynamic team behind her. So we are excited for her in that role and what she will bring to the regional office. So congratulations, Lisa. The other thing that I wanted to just talk with you about is to give you a little bit of an update. You may have heard us talk before that we are working on kind of a policy and procedure overhaul. Right now, we communicate through directives and guidelines, and then we have multiple manuals depending upon the subject matter at hand that people kind of have to know and figure out where to go and find the answer to. So we are working on bringing all of that together through an online manual that will be public facing. So it will be accessible to our staff internally with all the procedures that they need specific to their job roles, as well as information for individuals, families, service providers, and TCMs to know and understand what we will be doing and looking at, so you will have and know expectations for yourselves and how to work with that, and just know how to where to direct your questions and attention. And we're real excited about this effort. It is a huge and massive undertaking. As we roll it out, we will do it a chapter at a time. So we will have Amber walk you through the first chapter as we roll it out on one of these calls, just so that you can see it, but know that it will be phased in and evolve over time. And as those chapters roll in, then the other resources and the manuals and other guidelines will go away. So we're excited about that effort. We've had a lot of requests for work around this, both internally and from our stakeholder network. So look more for that to come. The last thing I just wanted to touch on was a question that went to Toy, and Toy, you can build on this around the budgets that you were asking about in connection. I think the one exciting thing to share is that the budgets won't look like what you're used to, because connection will automate many of those processes. As you're selecting services and building the plan, it will build authorizations and budgets, pulling that information in. So it won't be a form like you're used to seeing and where you go in and plug in numbers. So I think that is the biggest thing that's difficult for me to wrap my head around sometimes in thinking about moving to connection, is just the automation that will come from this system will be just life-changing for so many people. So, and with that, that's all I have on my agenda, and I'm going to pass it off to Jess, unless Toy, you wanted to add something to my comment for around the budgets.
That covers it, Wendy.
Yeah, thanks for pointing that out, Wendy. It is very exciting, and it's kind of hard to think about. We haven't seen it yet all, but a lot of the things that we do today will become not a part of what we do. All the calculating will be a part of the system requirements. So it's pretty exciting. Very excited for everyone to see it and be able to kind of witness what we're going to be working with in the future, which will free up time to spend on much more important things. So I do see another question in the chat regarding the apprenticeship program. I don't know if Dwayne is still on.
I am. So generally speaking, what I would say is we'll be reviewing all of that content in next Friday's webinar. Again, that's 12:30 until 2 o'clock. There's many different details, and it's really kind of hard to answer it in just a few minutes without providing this information. Also, anybody who has questions about that are invited to email me individually, and I will put my email in the chat box also.
Great, thanks, Dwayne. Yeah, it is kind of a question that seems simple, yet there's kind of a long answer about the program in general and how it works. It's the first Department of Labor apprenticeship program that we've had a partnership with, and so we're all learning this together, even though Dwayne is very familiar. So of course, that webinar next week will be recorded like all other webinars if you're not able to make it during the time. And I think the only other thing I wanted to mention is that next week we received notification that next week is the Senate markup process for our budget. And so we're really moving into the final stages, with May 6th being the last day that the General Assembly has to pass the budget. So when we talk to you next time, we will have a much better understanding of what our final budget looks like. But the fact that we've come out of the House and with the governor's recommendation still intact to have a historic investment in the programs coming over $700 million is pretty amazing, and really just wanted to call special attention to, especially since it's Autism Awareness Month, the House Budget Committee providing funding for beyond what was included in the governor's recommendation for 2 new autism centers in Missouri, one in Springfield and one in Joplin. And so that's very exciting, and we're looking forward to coordinating with everyone to roll out more access for individuals. And with that, I will let you go and hope everyone has a wonderful weekend. Look forward to talking to you soon.